Bismillahirrahmanirrahim. Assalamu alaikum. Dear students, today we will study the reticuloendothelial system. Up till now, we have a good knowledge about the different WBC and especially the neutrophil and monocytes, macrophages, that they play a very important role regarding the defense of our body against bacteria, virus like infective agents. They comprise a special type of the system as we have other systems in our body like respiratory system, gastrointestinal system. They comprises the reticuloendothelial system. This system has many important functions, but with that a very important function regarding the defense of our body is also played by this reticuloendothelial system. As far as its definition is concerned, it is a network of connective tissue fibers inhabited by phagocytic cells such as macrophages ready to attack and ingest microbes. It is an essential component of the immune system. Now, you have a good knowledge about the macrophages. What are these? As in the previous lecture, I have told you actually these are the monocytes residing out of the blood vessel. After attaining a little bit water, they become larger in size and now they are named as macrophages. And the most important function of these cells is to engulf the infective agent, that is phagocytosis. Because of that, they are named as macro larger and phages. Macrophages. This system, reticuloendothelial system, have important cells like monocytes, macrophages, and endothelial cells. The function of all these cells is the same, to have the defense against the infective agents. Macrophages, they reside at different places also. They may be mobile or they may be fixed in different tissues, in different body organs. For example, as I have shown here also, skin, liver, spleen, bone marrow, lymph nodes and all these special organs. So, the macrophages are mainly two types, fixed and mobile, but the function, that is the phagocytic cell, to phagocytose to engulf the foreign infective particles. We can have the different types of the macrophages depending upon their location. The function remains the same, but with the location their name changes. They are mostly present. First type is mobile, circulating in the extracellular compartment, but the fixed macrophages, they are present in different body organs, and with the different type of the organ their name differs. For example, in the lining of the liver, they are named as Kupffer cells, In the brain, microglia. In the lymph nodes, bone marrow and spleen. These are the reticular cells. In the skin, we have the histiocytes, and in the lungs, the alveolar cells. Actually, these macrophages, they are the, as I have told you, they are the monocytes out of the blood vessel. The first type, that is mobile, circulating in whole of the body, and the fixed type is present in the lining of different organs, which I have already told you. Mainly the organs which are concerned with the lymph, so that through the lymphatic system the lymph circulates in all these organs, either the lymph node or spleen, so that the infective agent can reach to these organs and easily can be killed at these places. These special organs, they are, we should say that they are the major stores of these macrophages. In general, the functions of reticuloendothelial system are: number one, as I have repeatedly told you, that phagocytosis. It is the direct action of the macrophages on the bacterial or the dead cell to engulf these particles. This process may be carried out indirectly through the assistance of antigen antibody reaction and production. This immune function will be studied later on in the next chapter in the following lectures. But you must know that it is included in the function of the reticuloendothelial system. Then we have the breakdown of aging RBC when it is matured or has spent its whole of the life. Then it is breakdown. The breakdown of RBC take place, and these phagocytes engulf the dead RBC also, and also the storage and circulation of iron. Through this very simple diagram, I want to show you how these macrophages, they are acting. They perform their function. You can see the bacterium coming in contact here with the receptors present on these cells, so that they come inside. Cytoplasmic lysosomal enzymes act on it and it is broken down, digested, and the waste material that comes out of the cell through exocytosis. Regarding their function, I have told you many things in the previous lecture and showed many animations also. One more diagram to show how these macrophages, they are performing their function. In the green color, we have different types of the bacteria, and they are cached by the pseudopodia coming from the macrophages. They are coming towards the source of the bacteria to engulf these bacteria, and then these are taken inside the macrophages. Lysosomal enzymes going on here to act on these vesicles to engulf, to kill and engulf these particles, so that in the end undigested remains of the bacteria that is excreted out of the macrophage. As I have told you that God has provided these macrophages in our body at different places. Why it is so? Because if God forbidden you got infection on the skin or any internal infection, they must be present all around there to kill the infection as early as possible to minimize its harmful effects. So, as our body is totally exposed to the environment and the skin is the outermost covering, what happens if it is injured? So that our body is exposed to all these agents. To protect our body, we have these defensive cells in our skin also. At that place, they are named as histiocytes. Then the special type of the storage houses of these macrophages, lymph nodes, and in the lungs also. Why in the lungs? Because of the air which is coming from outer environment and going into the depth of your lung in the alveoli. That's why if any particle that is going to make any disturbance to our respiratory function, that will be very much harmful for our body. It should be removed, it should be killed, removed as early as possible. For that purpose, we have alveolar macrophages also. So that in the alveoli, if any particle or any agent reaches, it must be killed as soon as possible. This is a very simple structure of the lymph node. You can see the afferent and efferent lymphatics through which the lymph is coming into the lymph node. And with the lymph, different types of the infective agents, they are also coming to these organs like lymph node. What will happen? This lymph will circulate obviously through the vessel. It will circulate in whole of the lymph node, and then through the efferent lymphatic it will come out. During its circulation inside the lymph node, as it is lined, lymph node, the structure and the tissue of the lymph node that is lined by abundant macrophages. So the agents which are circulating inside the lymph node, they are immediately killed by these local abundant macrophages. This is a very nice animation to show you that the different agents, harmful agents, they are coming through the lymphatics to the lymph node to be killed here. If any particle that is remain there and through the efferent lymphatic comes out, then it will be killed in the next circulation through any other lymph node or the same lymph node. As the blood circulates in our body many times, like that lymph is also circulating in these organs many times. Each time many bacteria or infective agents they are killed. If any remains there, it will be killed later on. Then in the lining of the liver cells, we have these macrophages where they are named as Kupffer cells. Why they are present there? Because as you know from the GIT, after digestion, many things they are going to through the portal circulation. Um, the liver is involved in all these processes, so that through the other circulation, through the lymphatics, through the portal circulation, many harmful agents they are going there, and they must be killed locally there, so that the clear lymph or venous blood that comes out. Macrophages of the spleen and the bone marrow that are also there, and in the structure of the spleen we have the red pulp and the white pulps and sinusoids lined with macrophages. And in the brain, microglia, in that we have abundant these cells also. This is a simple structure of the Kupffer cells present inside the liver sinusoids. In the spleen, we have the macrophages and either the infective agent that can directly going to the spleen macrophages, or initially the antigen antibody combination take place and then they come to the macrophages in combined form to be engulfed by these macrophages. What is this antigen antibody reaction? What are the other cells which are involved in the defensive action of the body? All these will be studied in the following lecture also. With that, we complete our reticuloendothelial system and coming again to the process of inflammation. Last time I have told you how the defensive action of neutrophil take place whenever we have any infective site outside the blood vessel, so that through the chemotactic forces the neutrophils they are attracted towards the infective site. Now I am again telling you the same things with more detail, or I should say the whole story of the inflammation. Up till now we have a very good knowledge about the role of the or the function of the neutrophil, monocyte and macrophages. Because these cells they are going to play the major role in the process of inflammation, defense against inflammation. By the definition, the process of inflammation is it is a protective response involving the host cells, blood vessels and chemical mediators to eliminate the initial cause of injury and the necrotic tissue resulting from the insult. So what is the process inflammation? Whenever any infective agent attacks our body, it damages the tissue cells. So this injury must be minimized. This infective agent must be killed as soon as possible, and it should be removed from the injured site also. So, the steps of the inflammations involve initially the vasodilatation of the local blood vessels so that excess local blood flow take place. Then it is followed by increased capillary permeability. What is meant by that? So that it should give the space to the specific cells to come out of the vessel wall. Leakage of plasma proteins and fluid into the interstitial spaces through increased capillary pores. It, you may observe this thing that whenever we have any injury, what steps they are followed? We have there some redness, there edema or the swelling of that site also. Why that is? The swelling at the site of the injury is because of this increased capillary permeability. The redness is because of the vasodilatation at the local site, so that more and more blood should reach to the infective or injured site. Then the leakage of the plasma protein and fluid take place, which creates edema or the swelling or the fluid accumulation at the injured site. Due to increased amounts of fibrinogen and other protein leaking from the capillaries that take place, clotting of the fluid in interstitial spaces. The next step is the migration of large numbers of granulocytes and monocytes into the affected tissue. It is followed by swelling of the tissue cells. Proteins, as I have told you previously also, proteins leak out at the site of injury, tissue fluid become hyperosmotic, water diffuses and edema is there. Also, because of the local stimulation of the neurons, you may feel the pain there. Main signs of inflammations are pain, redness, loss of function, heat and swelling. As far as the vascular events are concerned, we have initially the vasoconstriction followed by vasodilatation. Then local hydrostatic pressure is elevated, increase in vascular permeability, transmutation of fluid, slowing or stasis of microcirculation, and the main thing is the leukocytic margination. As I have discussed this margination in the previous lecture also, that these cells normally they are circulating inside the blood vessel in the central portion. To kill the bacteria, they have to come out of the blood vessel. For that purpose, initially they are lined along the blood vessel, which is called the margination or walling off of these cells. Then the permeability increases. The pore size, endothelial pore size, that increases to allow these cells to come out and to reach to the infective site. These are due to the histamine, bradykinin, serotonin, leukotriene and all these chemical substances which are released at the local site. Bradykinin is present in plasma and basophils. Leukotrienes come from damaged cell, mast cell and basophil. Histamine produced from the mast cell and basophil. You may be confused with the mast cell, basophil and other these cells, but with the time, with the following lectures, I will tell you the details of all these substances as well. But at this stage, you must appreciate that whenever there is inflammation, the local site becomes more red. There is increased blood supply there. Here you can recognize or you can see easily the pus present over the tonsils. This is the tongue, and I am going to examine the throat of the patient, and here we have the tonsils which are highly infected, inflamed and infected. Now, what are our goals for the inflammation? Obviously, we have a well-defined process to kill the infective agent, to kill all these and to minimize all these harmful effects caused by the infective agents. And the first most important step is walling off effect of these cells. As I have discussed this already, then to remove the debris, prepare subsequent healing and repair. Now, this is the time when I should repeat the same thing, that what is the first line of the defense, second line of the defense, third line and so on. As our knowledge becomes more and more with the discussion of the monocyte macrophage system and the neutrophil, the role of the neutrophil in defense of the body, we have a complete knowledge about the reticuloendothelial system also. Different lymph nodes and other organs, they are also involved. In short, the first line of defense is within minutes, the macrophages in the tissues immediately begin their phagocytic action. First effect is rapid enlargement of these cells, then previously sessile macrophages break from their attachment and become mobile, forming the first line of the defense. So, as I have told you, the first line of defense, either the mobile or the tissue macrophages. The second line of the defense, that is the neutrophil invasion. In first hour or so, large numbers of neutrophils begin to invade from the blood, which is caused by the inflammatory cytokines. Increased expression of adhesion molecules take place. Integrin molecules on the neutrophil cause the neutrophils to stick to the capillary and venule walls, and this is the margination. As I have told you, after that, through diabetes, they come to the infective site because of the release of different chemotactic substances at the injured site. A very nice picture to show you how this process takes place. What is neutrophilia? Increase in the number of neutrophils in the blood is called the neutrophilia. Sometimes increases 4 to 5 fold and caused by the products of inflammation that act on the stored neutrophils in marrow to mobilize into the circulating blood. Now the third line of the defense, that is the second macrophage invasion. Monocytes from the blood enter the inflamed tissue and enlarge to become macrophages. That is, the first step is the macrophages which are mobile, which are circulating there. They reach to the infective site. Then the local macrophages which are present, they attack infective agent. Then neutrophils comes out, followed by monocytes present inside the blood vessel. They also come out, and once they come out, they are named as macrophages after attaining some water and becoming larger in size. So macrophages now engulf the bacteria, far more bacteria, about 5 times as many, far larger particles including even neutrophil, larger quantities of necrotic tissue, and also the macrophages play an important role in initiating the development of immune system. Now comes the fourth line of defense: increased production of granulocytes and monocytes by the bone marrow. Results from stimulation of the granulocytic and monocytic progenitor cells of the marrow. It takes 3 to 4 days to mature and leave bone marrow. Obviously, this step is occurring at later stages. What happens actually if the tissue macrophages, mobile macrophages, kill the bacteria completely? Our story of defense against these agents that stop there. But if the agent is there, the second line comes, then followed by the third line, then followed by the fourth line of defense. So, with the time, with the increase in the number of the agent, or either it is much more powerful or it is widely spread, all these things, they are encountered by different cells at different stages. So, if the present monocyte and macrophages, they are insufficient to kill the bacteria, now the bone marrow starts forming more and more monocytes, more and more these specific cells, so that the aim is to defend against these infective agents and to kill it. Yesterday also, in previous lecture also, I have told you that this story that prolongs unless until we are completely successful to kill all the infective agents. If it becomes insufficient, then different body systems like antigen antibody reaction and other system, they come forward to play their roles. If, God forbid, all these systems they become unsuccessful, we need the assistance of antibiotics there. So feedback control of the macrophage and neutrophil responses. About 2 dozen factors are involved in control of the macrophage response to inflammation. 5 of these play a dominant role. Number 1 is the tumor necrosis factor, interleukin 1, granulocyte monocyte colony stimulating factor, granulocyte colony stimulating factor, monocyte colony stimulating factor. These factors are formed by activated macrophage. Increased production of granulocytes and monocytes by the bone marrow is due to 3 colony stimulating factors. GM-CSF stimulates both granulocyte and monocyte production. Others, G-CSF for granulocyte and M-CSF stimulates monocyte production. So in this way, these specific factors, they are going to initiate the excessive production of these specific cells. So because we need more and more cells. But it doesn't mean that all these steps they must be followed. No. If At any stage, we become successful to kill the bacteria infective agent, then whole this story that stops there. We will not go further. But if there is no success, we reach to the we go to the next step. More complex defensive system they become activated. This is the picture to show the control of bone marrow production of granulocytes and monocyte macrophage in response to multiple growth factors released from the activated macrophages in an inflamed tissue. Lastly, what happens, that is the once they are killed, the dead infective agents gather. It is named as pus. So how the pus is formed? A cavity is excavated in the inflamed tissue. This contains portion of necrotic tissue, dead neutrophil, dead macrophages and tissue fluid. This mixture is commonly known as pus that may be absorbed after autolysis or may be removed surgically. You can remove with hands if it is present on the skin and smaller size, or if it is in larger size, or it is inside the body, it may be removed surgically. So with that we complete today's lecture. I hope up till now you have a better understanding about the process of the inflammation, about the function of the neutrophil, monocyte and macrophages, and also what is the role of the reticuloendothelial system. Okay, thanks. Allah Hafiz.